Namaste everyone. Welcome back to live stream sessions. So today I am discussing about the topic of hormonal imbalance. Why I took this topic is actually I was planned to explain this hormonal imbalance topic on the Women's Day, that is March 8th, but due to some inconvenience I was not able to take a session on that day. So I chose the hormonal imbalance. What is this hormonal imbalance and why I chose on Women's Day only this particular topic is obviously as we all are working women now, we before it was considered as a woman can't do some works, she can't work out and she can't do some type of works. But nowadays we are showing that women are not lesser than any men, we are equal to them. Then too, in some maybe in family or maybe in relatives, they will give a special place to a working woman, that they will give a special respect to a working woman. Why? Because though we are working equal to men as they are working physically, we are doing same thing, and we are getting pay same thing. But why they are giving special place rather than men is this special topic is this hormonal imbalance. In this hormonal imbalance, nothing but in which all stages we will get hormonal imbalance. One is menarche, when our menstrual cycle starts, and one is menopause, that is when this menstrual cycle comes to end, and another thing is pregnancy. In these all conditions, and these all are related particular for the woman. In these all conditions, due to hormonal imbalance, the woman goes through these several changes, like maybe mental changes or emotional changes or physical pain, everything. Every matter she suffer from that. And then too, with these all sufferings, she will be doing her job outside the home or outside the place, everything. She will be move on in her workplace also with her changes, hormonal changes also. So particularly it was chosen on Women's Day, that what are these hormonal imbalance and how it's affect the woman's body, we'll see today. So this was my slight introduction about me. So what is a hormone? What is this hormone and how it works? We'll see. First thing is, these hormones are a chemical messenger, a small chemical messenger used in our body by endocrine system. They coordinate with our organs. Hormones are produced by glands. Especially, it is used by endocrine system, and these hormones are a small chemical messengers which are secreted or which are produced in the glands, and these coordinate with the organ. This is about the what is its hormone. It will be produced through our glands. It works or it is used from endocrine glands, and it coordinates with the organ. How it coordinates and how it works, that is, how do these hormones work? Hormones are produced by specialized cells in glands. Glands secrete hormone into an extracellular fluid. Blood transfers hormones to targeted sites. Hormones cause changes in targeted cells. No need to explain, right? It is clear point. That is, it is produced in a glands, and what these produced hormones will do, these will get transferred in the fluid, nothing but blood, and through blood it will reach a particular site or particular organ to get reacted. When these hormones reacts in a positive way or in normal way, the normal functioning will take place. Our whole body functioning are done through these hormones only, the main functioning, like because what these chemicals will do, they will transfer a messenger through hormones, right? So our body functions are carried out through these hormones only. But if they are in normal state, obviously the normal functioning will go through, and if it is deficiency or if it is more than what our body needs, then it will cause a happy or stress or clinical complaints in our body. Best example for this hormone functioning in especially in girls is nothing but our ovulation or nothing but our menstrual cycle, because every girl have the ovary from birth itself, right? But she will not be having ovulation or menstrual cycle till she gets menarche, right? From birth only she will be having ovaries. But when this FSH and LH hormone transfers through the blood and reach ovary, what they will do, they will mature a ovary. After maturation of ovary through the estrogen hormone, these will start to secrete the ovum, that is egg. From then the girl starts to have a menstrual cycles, right? Maturation of ovary will not be till this FSH and LH hormone gets targeted to the ovary and make the ovary mature. These maturation takes place through the blood. After maturation of ovary only, the girl will be having menstrual cycles, right? So this is one of the example how these hormones work, right? Next. As according to our study, we have 50 types of hormones in our body. Now in this session, we can't go through all the 50 hormones, how they work, what they work, on which organ they work, right? So I took only basic two hormones, that is happy hormone and another thing is stress hormone. These two hormones are a basic hormone to produce other diseases or complaints in our body. So especially what is this happy hormone? Obviously it is a hormone, it is a chemical messenger, but it will react as a happy feelings, happy expressions. This happy hormone again are subdivided into four types, that is serotonin, oxytocin, dopamine and endorphin. These four are the happy hormones. How this serotonin works? Mood stabilizer. Maybe when it more sensitive to diet than any other neurotransmitter. For example, if we have repeatedly like acid creating foods like junk foods maybe or any other foods, irregular meals, obviously due to increasing of HCl, due to acidity, we will get the headache. This one, or when we have our liked food, that if we are craving for anything and if we have it, when we feel the happiness, that hormone is nothing but serotonin. That is a mood swing hormone. For example, another thing is when about kids, if they want a mobile and if you give a mobile, they will be very happy, right? And that only vice versa. If you take it, they will get into angry or frustrated. That is nothing but it will be expressed by the serotonin hormone. And another thing is oxytocin. Oxytocin is the love hormone. It may be released during sex or childbirth or lactation. It may be any love. Love means not only with the sibling, not only the couple's love. It may be mother's love. It may be partner's love. It may be a sibling's love. Anything. When you get a love feelings towards someone, this oxytocin hormone will be released. It gives the message to your brain that you should show love. That love will be expressed out through our body. And next hormone is dopamine. This is a reward hormone, reward chemical. When someone appreciate you, that you are doing a good job, you are working very nicely, then what feelings you will get, like happy feelings, that comes through the dopamine. And next hormone is endorphin. This is works as a painkiller. For this, best example is yogas or asanas. Obviously, especially when you go to the Ayurvedic physicians, they will advise you some asanas or some yogas or some exercises according to the your complaints, right? It won't mean that if you do that exercise, your disease will be cured. But how it works, when you do some asanas or when you do some exercises for that particular muscle, this endorphin hormone will be released in your body, and this endorphin hormone will reach to that site or muscle and it will decrease the pain. That is the work of endorphin hormone. So these all are happy hormones, means they will make our body in a happy sense. Next, we'll see the stress hormone. The stress hormone is cortisol. Uh, when we for some situations, when we release this cortisol hormone, when we take stress, when we take tension, or when we'll be in hurry, when we'll be frustrated, but has like when our mind will be disturbed in a negative way, this cortisol hormone will release. And how it acts, like it may be the clinical complaints when this cortisol hormone releases are maybe short breath or heart rate increase, blood flow increasing to the musculoskeletal, and blood sugar increases, pupil dilates, and blood pressure increases. These are negative impact on health will cause due to this cortisol hormone. So how it works, we will see. So common stress symptoms, common, not with any chronic disease or not with any complications. Common when we take stress or when we are frustrated, this cortisol hormone will release, and what all complaints we will have, like symptoms we will have, we'll see. That is irritability and anger, loss of appetite, poor sleep, fatigue, chest pain, acne, back pain, headaches, lack of energy, like digestive problems, it may be constipation or loose stools, lack of motivations. These all are the common symptoms when we get stressed, right? These all are the common symptoms. These all are for time being. Next, I'll show what is the time being clinical features and what is for complication stage. So these all are common when we take stress, especially as example in working women or men, anyone in working, when we have timed out for attending a workplace, like for example, we will be having 9 o'clock here punch time, and it's already 9 o'clock in a home, we'll be in hurry burry, we'll be in tension, so we will run. At that time, the cortisol hormone will release, and these all complaints like short breath, everything. Another thing to understand for the children, for next example is in professional colleges, we will be having viva, right? Oral examination. While giving oral examination viva, when you are standing out of the classroom, how your feelings will be? You will be having rapid heart rate, you will be having breathlessness, your body will be shivering, and if we check, your blood pressure will be increased or decreased, hampers. These all complaints will be having, right? These are all common stress symptoms, not only for professional, for even for working women. When you have lot of work in home, and if you are not able to complete it in a hurry burry, you'll be taking stress, right? All are working women, especially if they are not working women, with working women, with the housemakers also. In morning times, we can see them. They will be in hurry burry, shouting to their children, shouting to their husbands. So this is nothing but stress, right? Due to this stress, the cortisol hormone will be released, and these are complaints like frustration, shouting, mood swings. These all will be the complaints. So how this stress will affect our body in which positions when common symptoms turn to complications. These in previous slide what we saw are common symptoms. Like for example, it is a time being. If we continue same thing, then in which body part how it will affect. That is, one thing the complaint will be hair loss due to long-term stress, I am saying, and asthma, weight gain, diabetes, headache, heart diseases, and poor gut health. These all will be the, if we take continuous for longer duration stress, then these all will be the complication stage or complication ill health in a body. For example, here is during menopause, our ladies will be having many mood swings, hormonal imbalances, everything, right? Due to the stress, what they will, like due to this all complaints, what they will feel, I had any big health issues, so I am suffering. They will take stress. Due to their stress, again these all complaints will start in them, right? Especially nearer to menopause ladies and menopaused ladies. These are, they will be having these all complaints due to stress, overall life stress maybe, or their health stress maybe. Due to their health stress, everything will be caused. And another thing in weight gain I want to say is due to this hormonal imbalances only, especially in PCOD children, girls or without PCOD also, due to these hormonal imbalances, when they have junk food, especially this cortisol, what it will do, it will be having high impact on GIT. So when this cortisol hormone will react to this GIT organ, then the woman will be having body structure like only middle part will be fat one and upper and lower will be thin. For example, the C-section ladies, we can see these C-section ladies in the same way, body structure, right? Not only C-section ladies, many others also will have this structure, like only middle part will be uh, weight gained, like fat one, and the other parts will be normal, due because it will be due to this stress. This stress cortisol hormone reacts with the GIT, then it will react, it will make the fat deposition only in the middle part of the body. So moving towards the next slide, these all are the signs and symptoms of stress in short term. And if we continue this short term for longer duration, how it will be caused, or what all clinical features will be caused. In short term, for example, as I said in Viva, or when we have um, lesser duration stress in workplace or in home only, when we will be in hurry burry. For shorter duration, for short term effects, it will be having faster breathing, faster heart rate, dry mouth, sweaty palms, tension in neck, tension in shoulder, nausea, constipation, diarrhea. These all are the complaints of short term. After resolving that matter, the complaints will be released. But that only if we take the stress for longer duration, long term, then it will affect as a high blood pressure, headache that too, especially migraine headache, that is offside headache, dizziness, or repeatedly frequent attack of headaches, and excessive sweating, nervous indigestion, neck and back pain, rashes, allergies, and ulcers. These all are the complaints when we follow for shorter duration stress. If we take for a longer duration, then these all will convert into the ill health or issues in a health. And with this happy hormone and stress hormone, still few hormones I collected, those are affecting our life in a routine way, like in one or other way. These all will be our routine factors in our routine life, right? So which are those? Especially thyroxine hormone, insulin hormone, growth hormone, testosterone, estrogen, and progesterone. These 6 hormones we'll see routinely in our life, maybe female or male, right? How? That is, thyroxine hormone, in its deficiency, it will cause the stunted physical and mental development in children, or the subcutaneous fat, rough skin, and lack of energy. These all will be caused in adults. If it is in children, there will be stunted physical and mental development. If it is in adult, buildup of subcutaneous fat, rough skin, and lack of energy will be caused in deficiency of thyroxine. That only in excessive. If this thyroxine hormone is in excessive, results in goiter, increased metabolic rate, heartbeat, and restlessness. These all will be caused in excessive secretion of thyroxine hormone. Nothing but hypothyroidism and hyperthyroidism also we can consider, right? Then coming for insulin hormone, how it works? In deficiency, obviously it will be hypoglycemia or low blood, like diabetic mellitus with symptoms of high blood pressure level and sugar in the urine. That only in excessive. If this insulin hormone is producing excessive, then abnormal in lowering of blood sugar, level, which could lead to shock and coma. If it is excreting or secreting more than our body need, then these complaints will be present. Next one is growth hormone. Obviously, if it is deficiency, there will be dwarfism. You can see some people, like if they are 18, 19 years old, also their height will be like 2 to 3 years kids, or 4 to 5 years kids, right? So that is dwarfism. If this growth hormone is secreting excessive, then results in gigantism in childhood, or acromegaly in adults. And next one is testosterone. This testosterone is particularly for male secondary sexual hormones. If this is having deficiency, then development of male sex characteristics in adults will be delayed. And if it is excessive, secreting excessive, male characteristics and early puberty will be had. And now you may be thinking, what male puberty? In males, what puberty will be, right? Like in females, if we have puberty, then the menarche will start, and other secondary sexual characteristics will start. Like same way in males, you may be observed in 8th or 9th standard children, their voice will change, the mustache starts to come, the beard starts to develop hairs and axillary hairs. These all are nothing but the secondary sexual changes. Nothing but we can consider as a puberty in male. So next is estrogen. How it works? In its deficiency, the delayed or development of secondary characteristics in females, it will cause, as testosterone is male secondary sexual hormone, this estrogen works as a female sex hormone. And in excessive, the female characteristics and early puberty may occur in females. And coming for progesterone, this is again preferably for females. That is, in its deficiency, it may cause abortions of embryo, and in excessive secretion, it may cause failure and the stillbirth. These all may happen. And these are 10 ways to lower cortisol and reduce stress. That is, in regular routine, what all changes you can do? Regular quality sleep, exercise regularly, clean and healthy diet, avoid and limit alcohol, hydrate and limit caffeine, mindful meditation, an organized living space, spend time outdoors. Outdoors means not working place or any relatives function, like quality time, quality outdoor time, indulge in hobbies, cut unnecessary stress. These are 10 rules you can follow in your daily routine. Try to follow in your daily routine to reduce your stress. And these all are some herbals I collected that you can use in your daily routine so that you can balance your hormones. If it is imbalanced, also you can balance. And if it is balanced, also you can maintain in the same way. That is normal. Some our kitchen items we have, like carrot, fenugreek seeds, nothing but mente and gelatin, and maca seeds, and here this ashwagandha, black coca, white tex, and the chastaberry, and dongqua. These all what you are seeing are I can see in my, like, our region used words, but it will be confused who are seeing out of state people. So you can refer, like, these all medicines you can search in a net, and you can have a reference on your local language. And still more home remedies or herbs that we can collect are these all: makka seeds, ashwagandha, these all, shilajit. These all you can collect on your home-based regular language tool, and you can use regularly in your daily basis. So this was about the hormonal imbalance and how we can maintain our hormones on our daily routine and how it reacts on our body. So if you have any doubts, you can comment in a comment section box. Thank you.